Task: perform first aid to restore breathing and/or pulse. Conditions: during daylight, you see a casualty who is unconscious and does not appear to be breathing. You are not in a combat situation or chemical environment. Standards: within 5 minutes, take appropriate action to perform first aid to restore breathing and/or pulse. In sequence. 2. The candidate continues until the casualty breathing or pulse returns.
Yeah. Okay. We're good.
Performance measure 1. Perform first aid to restore breathing and/or pulse. Alpha. Roll the casualty onto back and place on a hard, flat surface. 1. Kneel before the casualty. 2. Raise the near arm and straighten it out above the head. 3. Adjust the legs so they are together and straight or nearly straight. 4. Place one hand on the back of the casualty's head and neck. 5. Grasp the casualty under the arm with the free hand. 6. Pull steadily and evenly toward yourself, keeping the head and neck in line with the torso. 7. Roll the casualty as a single unit. 8. Place the casualty's arms at sides. Bravo. Open the airway. 1. Head tilt, chin lift method. No spinal or neck injury is suspected. Alpha. Kneel at the level of the casualty's shoulders. Place one hand on the casualty's forehead and apply firm backward pressure with the palm to tilt the head back. Charlie, place the fingertips of the other hand under the bony part of the lower jaw and lift. Delta, bring the chin forward. Charlie, check for breathing. 1. While maintaining the open airway position, place an ear over the casualty's mouth and nose, looking forward the chest and stomach. 2. Look for the chest to rise and fall. 3. Listen for air escaping during exhalation. 4. Feel the flow of the air on the side of the face. Delta, give breaths to ensure an open airway. 1. Maintain the airway and gently pinch the nose closed using the hand on the casualty's forehead. 2. Take a normal breath and place your mouth in an airtight seal around the casualty's mouth. Delta, give breaths to ensure an open airway. 1. Maintain the airway and gently pinch the nose closed using the hand on the casualty's forehead. 2. Take a normal breath and place your mouth in an airtight seal around the casualty's mouth. 3. Give 2 breaths, 1 each second, taking a breath between them, while watching for the chest to rise and fall, and listening and/or feeling the air to escape during exhalation. Note, you see the rise and fall of the chest. Echo, check for a pulse for 5 to 10 seconds. 1. Use the first 2 fingers in the groove of the casualty's throat beside the Adam's apple on the side closest to you. Note, do not use thumb. 2. You find a pulse, but the casualty is not breathing. Alpha gives breaths at the rate of 1 every 5 to 6 seconds, 10 to 12 breaths per minute. Bravo. Recheck for pulse and breathing every 2 minutes. Charlie. Continue until the casualty's breathing returns, a qualified person relieves you, a physician stops you, or you are unable or too tired to continue. Note, the casualty's breathing has returned. Foxtrot. Once the casualty is breathing and has a pulse, place the casualty in the recovery position. Note, the person's arm that is nearest you at a right angle to their body, so it is bent at the elbow with the hand pointing upwards. Gently pick up their other hand with your palm against theirs, palm to palm. Now place the back of their hand onto their opposite cheek, for example, their left cheek if it is their right hand. Keep your hand there to guide and support their head as you roll them. Use your other arm to reach across to the person's knee that is furthest from you and pull it up so that their leg is bent and their foot is flat on the floor. Gently pull their knee towards you so they roll over onto their side facing you. Their body weight should help them to roll over quite easily. Move the bent leg that is nearest to you in front of their body so that it is resting on the floor. The position will help them to balance. Gently raise their chin to tilt their head back slightly, as this will open up their airway and help them to breathe.